I have a question for Daryl and Ryan, if you don't mind, Bill, on that.
Please.
Can I take it back?
This is your tryout to see if you can host the show.
No, not at all. Not at all. That's your job. Ryan and Daryl, do you have any idea what percentage of telehealth visits you do?
18.
18%? Yeah.
I think we're at like 8 to 10 right now. I mean, during COVID, we were 100% behavioral health. We're all telehealth.
Same. And that's one thing. We're at about 8% right now, and we have a growth goal to try to get to 20%. Because we have a lot of people delaying care because of transportation issues and things like that. And we just hired a care coordination manager who's going to try to work on those more kind of social determinants of health issues and connect them with resources. But we'd really like to grow that.
The interesting thing about telehealth and the growth within that is when I came on board, one of my early initiatives was actually clinic to clinic telemedicine, because again, we have really small clinics. We don't have a big population base where we're even like, hey, we're going to use this as the hub and spoke out. So my psychiatrist, we have a full-time psychiatrist, which for FQHCs where we serve is an anomaly, but she lives outside of Bozeman because that's where she wanted to live. Our psychologist lives up on the Canadian border, and our nurse care manager for them lives in Lewistown. And so not only do we have to use Teams to communicate behind, but we're using telehealth. That psychiatrist is seeing patients at 13 sites. And so that was our initial goal, was like, how do we get clinic to clinic telemedicine figured out? And so we spent pre-COVID years, got that buttoned down, have a great platform. There's always workflow questions, but the actual platform is great. Technology is good. The people's the hard part. When COVID hit, and we obviously, like everybody else, dove headfirst into direct to patient. We got to get this. And the platform adapted to it very well. We were very thankful, great partner. But coming out of COVID, I'm having to help people understand that it doesn't make sense for us to have patients coming to a clinic to do a telemedicine when they could just do it from home, and we don't tie up a patient room. Even if it's not in your clinic, you're tying up a patient someplace else. And it's actually been kind of an interesting trying to get people to use direct to patient telemedicine as opposed to coming to the clinic. And the clinic's always a great option if you do have people who have bandwidth issues, but so much of it is just, they just want to schedule in person. It's actually try to keep the patient home. We're going to save ourselves a lot of money. We're going to save them a lot of money and time.
Yep.
And that's been for us the biggest growth in the last couple of years, is actually trying to transition as much clinic to clinic telemedicine to direct patient telemedicine.